Hello everyone. Problem? Okay. Again, hello everyone and welcome to our event, Mosquito-Borne Disease, Integrated Strategies and Innovative Solutions. My name is Frederick and I will be your moderator today. Did you know that in 2022, 249 million cases of malaria were reported? That's nearly the entire population of Indonesia. Even more alarming, malaria caused 600,000 deaths, similar to the number of deaths caused by COVID-19 in countries like France during the pandemic. As you can see, mosquitoes continue to pose a major global health threat, and the challenges are only increasing with urbanization and climate change. What can we do about this? Here at Envu, we have 60 years of experience in vector control, and we're committed to fighting vector-borne diseases through innovation, research, and strong partnership. That's why we brought together this panel of experts to discuss the latest strategies and solutions. And I'm happy to introduce you to our experts. Dr. Corinne Beaufort, Associate Professor at the London School of Hygiene and Tropical Medicine and Research Leader at Craig Benin. Dr. Beaufort will share her insights on developing new products for vector control. Professor Fredos Okumu from the University of Glasgow and Senior Scientist at the Ifakara Health Institute, Professor Okumu brings deep expertise in identifying new approaches to controlling vector-borne disease. Dr. Kristen Fornadell, Senior Technical Coordinator with the Innovative Vector Control Consortium. Dr. Fornadell will provide her knowledge on the development of cutting-edge solutions for vector control. Please join me in welcoming our guests. We also encourage the audience to submit the questions in the comments, whether you're watching on LinkedIn or YouTube. We'll address your questions during the second half of the panel. So, without further ado, let's begin. So, the first question is addressed to you, Corinne. Can you tell us what is integrated vector management?
Thank you so much, Fred, and thank you to Envu for inviting me to be part of this panel. It's a pleasure to be with you today. So I'm going to define integrated vector management from a standard perspective, looking at it from the lens of the World Health Organization, that integrated vector management is a decision-making process that encourages the optimal use of resources in an efficient, cost-effective, and sustainable way, which is also locally adapted. So it's to ensure that resources are used to target multiple vector-borne diseases, such as malaria, dengue, Zika, chikungunya, even leishmaniasis, and Chagas disease. And we are using a multiplicity of tools in space and time where possible, but also targeting them where they are where we can expect the greatest impact. I think the operationalization of integrated vector management was much more handled in the Global Vector Control Response, which was released in 2017. And this puts in place the different actions and pillars that countries can really apply. And it's about using an inter and intra-sectorial approach where you bring in different sectors to collaborate to reduce the burden of vector-borne diseases. And you engage and mobilize different communities so that they are part of the actions that you take. And you use enhanced vector surveillance, not just trying to do surveillance for one type of disease or one type of vector, but many at the same time if possible. And you're also scaling up the best interventions in the best way possible. And an effective integrated vector management program would require a lot of country leadership, a lot of mobilization of funds and coordination. And in the end, it is expected that it should be cost-effective and sustainable. So thank you. That's my definition of integrated vector management. Yeah.
Well, thank you very much, Corinne. Very nice definition, very insightful to us. And I also like the fact that basically we are talking about integrated vector management. We are not talking about a single mosquito species, but also several mosquito species that are now coming together on different spots of the planet, which need to be addressed. The second question will go to you, Kristen. Why is it important to have integrated vector management strategy, and what tools do we have available? How can we best combine them to be more efficient and have a greater impact? Thank you.
Thanks, Frederick. Yeah, so as Corinne mentioned, preventing malaria and other vector-borne diseases requires a comprehensive approach using all the preventative tools that we have. And I think the best way to think about this is that each tool, vector control, be it vector control or other prevention tools like vaccines or drugs, act as sort of a slice of Swiss cheese. If you have a slice of cheese, Swiss cheese, and it's one prevention tool, there are holes in that slice and holes that those mosquitoes can fly through to bite you. If you have two slices of Swiss cheese next to each other, well, some of those holes are now blocked. They might still find one to squeak through. If you layer a third, now you're pretty much, not able to get through any of those holes. And now you have a really solid level of protection. And this is what happens when we're able to layer our prevention tools in an effective, cost-efficient manner. As for the tools that we have available to us, if we're thinking about malaria, really most countries are now relying on our ITNs, IRS, larval source management. There are new tools, but we can get into some of those down the line, because those are the core tools that are currently being used. For Aedes, of course, we also have larval source management and space spraying. And so really how you choose which tool or tools to combine in an area, I think is really related to the local context. So I'm thinking specifically now in terms of malaria. If there's an area where we know that people aren't using their bed nets because they have really robust washing practices, or it's really hot and they just don't like sleeping under them, does it make sense to put a net that might only last a year in that place, or should you do some IRS there with also some larval source management? Maybe there's another area where you know your vectors are not landing and resting inside, so there you choose to forego the IRS and maybe stick with bed nets and combine that with maybe some of the new tools that are coming down the road. So it really depends on that, as Corinne was saying, that local data informing the decisions around which tools to combine and put in different places that will help you in your goal of disease prevention.
Good. Well, thank you very much, Kristen, for this answer. Is there any addition from the other panelists, Frederick or Corinne? You want to add information on what was said by Kristen? Sorry.
Yes, I think my colleague said everything that needs to be said here, really, and it was great that Corinne highlighted three important points. Number one, she mentioned that we have to use data when deciding on which interventions to use. She also said that when you do integrated vector management, you have to consider multiple vector species. And I know that in the vector biology field, people tend to be very focused. So someone is just an Anopheles guy, I just deal with malaria, and others might say, I just work on Aedes aegypti. I think the concept of integrated vector management allows us to focus on multiple vector species. And I think that is becoming more apparent and more important in countries where our colleagues are having to deal with Anopheles stiffinsi, for example, which has a fairly similar aquatic ecology as Aedes aegypti. And the third thing that she said was that we have to consider multiple interventions. And I think Kristen emphasized a lot on this point. The only thing I would like to add here, Frederick, is that countries or implementers have to make a very careful decision here using the data as to how many interventions they want to layer on. Because there are consequences to doing more than one thing. So usually we don't have resources that are infinite. We don't have, $1 trillion to do this. So the moment you introduce a second intervention, you are eating into the resources that were available for the first intervention. So what you have to very carefully decide is which of your interventions are the most important, which ones will give you the greatest value. And so a country might choose, for example, that we're just going to do these two things. So we're going to do them super good. We're going to do them perfectly. So even if it's a Swiss cheese, we're going to make sure there are no holes. So the holes are as few as possible. Another country may say, well, we have enough resources. We can layer all these things. We can put intervention X, Y, Z, A, B, C, D here. And that's okay. But I think in most cases, resources are limited. And therefore, this data use that Corinne mentioned has to be integrated in such a way that we are selecting only the very best, in other words, the most impactful interventions in those circumstances, and choosing the minimum number that you can do so well so that any addition gives you a non-significant marginal value. So I think that's a very important thing because we don't have sufficient resources always. Back to you guys.
Thank you, Fredros, for those comments. Corinne, do you want to add on what was said already?
Yes. Yeah, I would like to add to the concept of how we combine interventions. And I agree with Fredros and with Kristen as well that we really don't have too many resources. So we cannot just be talking about, okay, let's do blanket interventions, let's apply ITNs everywhere, let's apply ITNs everywhere, so IRS everywhere. So we must be really strategic in the way that we select interventions. And we also have concepts of like subnational tailoring and prioritizing interventions that are there to guide programs on how to deploy interventions, how to make sure that they are going to the areas where they need them most. And as malaria continues to go down, what we find is that we must be much more targeted in our approach, so that if we want to deploy an intervention, we will have to make sure that it goes where we can be sure that we're going to see the highest impact. But in this slide, I also want to talk about how we put interventions together. We need to consider how those interventions interact with one another. And for example, in an area where you have a lot of outdoor biting, if you are adding another intervention, if you have the resources and you want to add another intervention, you should also consider that you have, say, a bed net in the house, but you also have a tool outside that addresses outdoor biting. And if you were in an area where nets really don't last, where they last just about two years at most, that's the average that we see, you want to deploy an additional intervention in the third year when it's the efficacy of your core intervention has really gone down. So there is a lot of thought to be given into how we deploy interventions, not just about how we target them in different spaces, but also how we combine them for the most efficient or the best outcome that we can get. Yeah.
Well, thank you very much, Corinne. And this is very important point. And I mean, as we all know, I mean, most of the intervention are data-driven decisions. Do you believe that in the countries and different programs they have enough means to do those data-driven decisions, or is there anything missing there?
Yeah.
Do you ask any specific person, or we can?
Was more open because just came through, but Fredros, happy if you.
I mean, you asking whether the endemic countries have sufficient resources or capabilities to do data-driven decision making, and I think that broadly speaking, they have the ability to do decision making at the local ecosystems. I think there is still some, additional input that can be added there. In other words, this capacity still needs to be improved. Often you have 2 or 3 people with the ability to do the analysis, and maybe we need more. So I think the best answer here is that yes, countries have some capacity, but I think most countries will do with an additional, with a supplementation or better capacitation. And this, of course, refers not just to the data science itself, but also the interpretation of the results of this analysis. And sometimes, for example, if you do a geospatial model or a statistical model of A plus B, what do you get there? You want to run that result with your stakeholders to figure out, okay, which of these results are you most happy with? And that might include bringing in like political decision making. It might mean looking at the available resources, like we were saying earlier. It might mean considering ethical considerations and even available regulatory systems. So your models might say this is the best tool here, but your in-country regulatory systems do not yet allow that intervention to be in place. So in addition to the data-driven decision making, we have to then add that second layer where in-country partners are sitting down and saying, okay, this is what the models say are our best options. Which of them can we actually implement, or what adjustments can we make? So there is an iterative process there that basically means you have to bring in as many partners as possible. Of course, not too many, but you have to bring in all the important partners to make sure that these decisions are interpreted in the most effective way possible. Kristen and Corinne, I'm sure you guys have some additions on this topic.
Yeah, I think that last part, especially about the iterative process, I know, that, and a lot of countries do have the ability to collect the data. It's the analysis and the interpretation that I think sometimes gets bogged down. And so we definitely need to make sure that countries are able to interpret and present their data and present their case for where different interventions need to go. And once they do to the funders, then it should be a back and forth conversation, right? And it's not, this is what we found. Oh, the models, then we plug them in, it tells us this. As you said, the models may not understand the realities on the ground. They may not understand, well, this is an area near a lake and people, tend to use these nets for fishing. And so they don't want this type of net there. And the models don't know that, right? The models are based on, generic life of a net. With a decay curve, but it might not be the decay curve in the country. The models don't necessarily account for all of the SBC issues and use issues in country and those pieces that the country programs would know. So you have to take the data, the model will come back, and then you have to talk back and forth about how to use that to get the best plan in place. And I think the countries that do it best currently are the ones that are having that back and forth iterative conversation.
Thank you, Kristen. Corinne, any additions?
Yeah, and maybe just to add to that, and I agree with Kristen, there is the modeling, but there is also how do you interpret them in local context. But also I do recognize that even the first step of being able to really process and interpret data is a bit of a weakness in a lot of the national control programs. And it will be important that programs really commit resources into getting the adequate training that are needed to really effectively use the data that they have for modeling and for decision making. So I do recognize that there is some weakness in that area, and wherever any kind of support that can come into really boosting the development of skills and the development of capacity to use data in a local way, and not just waiting for, say, a country would send its data to someone in the north. Can you tell us what intervention we should put where? I would really be against that approach. But if that can be a country-led sort of initiative so that countries can fully understand where they are deploying interventions and how they make some of these decisions, I think I would really be in much support of that approach. Yeah.
Yeah. Thank you very much. Thank you very much, Corinne.
Fred, may I add one quick comment on this? Thanks so much to Corinne and Christian here. In the beginning, when Corinne was describing integrated vector management, she mentioned the global vector response. Is that what we call it? The WHO global vector response?
Yeah.
One item that is emphasized in that plan is multi-sectoral partnerships, but also just within in-country partnerships.
Mm.
And so often when people ask, do you have capacity to do this? People look at the national program and say, do you have people who can do that? And actually, in many cases, the national programs do not necessarily have to have the capacity themselves, because their day-to-day job. However, if you're working with, let's say, in-country universities or research institutions or in-country then all of a sudden you have a lot of expertise that is within your borders that you could tap into. So I think that being able to tap into these existing partnerships within the country can vastly expand the available resource base, the available capacity. And I see, I work a lot in Tanzania with my colleagues, and I see people like Professor Samson Kiware, the way that they work with the National Malaria Control Program. It's not necessarily to say NMCP must have modeling capacity. Mm-hmm. No, you could say, if Akara people, you do the modeling work and you give us the feedback. And that way you are able to, leverage and actually achieve much more, even if you do not have the head count or the manpower within the national programs. Sorry for interrupting that, but I just wanted to raise that point.
No, very good. Thank you very much for that point, Fredos. That's indeed very interesting, and we have heard also in the past that the capacity within the vector control space is quite important and sometimes limited in the countries, but we also know that maybe a shifting capacity between agriculture, vector control, public health can also greatly enhance some of the impact and the output. Now coming back to the intervention that we know well, especially we're talking about bednet, RS, larval source management, and there are some other ones coming on the top of that, some new innovations. From your perspective, what intervention would you prioritize to curb the threat of the diseases, especially when we have now, as we already said, I would say convergence of diseases and also multiple species that appear, Anopheles stephensii, we also have Aedes aegypti coming in the countries and sitting at the same place. Also some of those species being more invasive and replaces some other Anopheles. So what would be your recommendation there? Fredos, can you start answering the question, please?
I was hoping I would not be the first to answer this. Frederick, it's a very difficult question. This is a difficult question because mosquitoes are on one hand very simple organisms to deal with, broadly speaking. It's not a massive scientific challenge, if you think about it. I mean, diseases like malaria or dengue fever are not like cancer or tuberculosis. The point here is that we have known what to do about mosquitoes for 100+ years. And so when my colleagues and myself sometime in 2024 are still chasing new technology, I think we can do that on condition that those new technologies are going to be truly transformational. Mm-hmm. So for example, if we end up with gene drive modified mosquitoes that can really do the job at scale, then that becomes transformational. But to a large extent, we already know what we could do. And there are people who already did things like indoor residual spraying very, very well 100 years ago and did a very good job. I think at the moment, the problem is much more about financing than the intervention themselves. But if you just want me to mention interventions, of course, I can mention IRS, ITNs, and all that. Obviously, because it's Fredros, I would normally also say that those things are commodities, and you will need to do it again the following year, and the following year, and the following year, and then you are in this rat race. And so for me, I say, when PMI or Global Fund or Gates Foundation is willing to pay for these things, while they are willing to pay, the countries must, in the background, be putting in measures to build some form of structural resilience, so that on the day that the bednet business is untenable, you already have in the background things like good housing, good environments, a well-educated community, a little bit of less poverty. And this is the way you can sustain the gains. This is the way you can permanentize these gains. Now, in a poor community, if you just think we're going to distribute bed nets every year or spray houses every year, we're probably just enriching the companies and dancing around resistance and so on and not doing so much. However, if we can get something transformational, then maybe it will do that. So in summary, I think that we have some traditional systems, larval source management, indoor residual spraying, ITNs perhaps, that we can use to really drive cases down. But we have to remember that with those tools alone, we cannot normally sustain these gains. So in the background, we have to be building this structural resilience, which comes in the form of many more difficult things to do: housing, environments, health systems, education, which are beyond the health sector. And I think that is the only way we are going to sustain these gains. I would like to hear what my colleagues Corinne and Kristen have to say about this question.
Yeah, thank you, Fredros, and maybe let's ask Corinne to go after.
Thank you. I can really chip into that. And I have to agree with you, Fedros, 100%, because I believe that the ultimate solution to malaria is just getting rid of poverty. I also think that while we keep saying that, okay, over the years, malaria has declined, it's also because over the years, people are not as poor as they used to be, and they couldn't even afford drugs. They couldn't even afford a clean environment. So the two really go hand in hand. I think having a really clean environment, having better houses, that is the ultimate solution. But that requires a budget that would take, I don't know, it would take a long time to get there. And for now, we really need to work with what we have. And I agree with you, we already have all these tools, ITNs, IRS, that we can continue to deploy in the best way possible. But one thing I want to add to that is that even though we know how to control mosquitoes, how to control vectors, we also know that they change a lot. We have seen them change over time. At some point, we knew that pyrethroid nets were just going to get rid of malaria for us. But no, we started to have resistance to pyrethroids. At some point, we knew that by applying interventions indoors, we could get rid of malaria. But no, we started to get outdoor biting, people going out. And so the vector is not our friend. It's always changing itself. And that's normal. That's evolutionary. So we must always stay ahead. And to be able to do that, to me, it's to continue innovation. Really, we shouldn't be backing down. We should continue to innovate, continue to study the vector as it evolves, and we also evolve ourselves and stay ahead of it as much as possible. So that's what I want to add. Thanks.
Well, thank you very much, Corinne. Thank you very much for these additions. Kristen?
To follow up on both of what Corinne and Fredros mentioned, I also agree, in the end, the thing that's really going to get rid of malaria is sort of the economic development. But there's a vicious cycle, right, with malaria, where when people have malaria, it keeps them sick, it keeps them from tending their gardens and growing their crops. And so being sick with malaria prevents those economic gains in a lot of places, attending school and all of that flourishing. So I see what we're doing here, and what we really need to continue to do is try to break that cycle. So we're helping to put these interventions in to get these malaria reduced to help with those economic gains. And so eventually we can break that poverty malaria cycle. But as Corinne said, as we're trying to do that, those mosquitoes are evolving and changing. And so we do need to keep that innovation coming to stay ahead. I wanted to speak in particular to, I think, something that everyone's really excited about now, which are spatial emanators, which I see almost as a better bed net, right? When bed nets are preventing mosquitoes from coming in and biting people that are sleeping under them. But if you're not under the net, but still in the house, you can be bitten. The spatial emanator, the hope there is that if you're in the house, you will not be bitten because you've got the emanator in the house. You don't have to physically be under the bed net. Hopefully, we also might be able to take these outdoors with us, or when we're sitting on our patio, under the veranda, and then that could also help with some of this outdoor biting that we're seeing a lot coming up. And the idea then is, hopefully with these new innovations, we can sort of stay ahead of the malaria parasite and the vector and continue to chip in at that cycle to break it, so that eventually the economic development is what would really take off and help long term.
Yeah, thank you very much, Kristen, for these additions. Yeah, and indeed, the economics are always very, very important in that game. And as you mentioned, mosquitoes are evolving maybe faster than we can get new solutions, new innovation out in the field. So there's a race against the time that we need to gain. I see we have a lot of excitement and a lot of questions in the chat. So I think we'll move to the second part of these panel discussions and start to address as many questions as we can with the time that we have from our audience. But just before moving them, thank you very much, Fredros, Corinne, and Kristen, for all these insightful answers on the questions we have prepared. And let's go now to the questions we received from the chat. The first question, so how can we interest resources-constrained countries that clearly need new and effective solutions? Well, that's a difficult one.
Where do we get the money?
Huh?
Where do we get the money?
Yeah.
I guess that's what the question means. You mean the question from Navo now?
Excuse me?
I guess you mean the question from Navo now, right? The guy on the
I
chat.
think the question is from the private chat. Yeah.
Mm-hmm. Yeah.
Oh, okay. Okay.
I don't see who posted the question. Sorry for that.
Yeah, I can see the question on the general post as well, so I can see that. But I guess so. The point is, where do we get the money? And this is another very difficult question, but I think it depends really on leadership, leadership at country level, and prioritization of events. You know, where I come from, I see sometimes the government goes to China and borrows, $100 million, and they build, 50 kilometers of the road. And maybe it's a good thing to do that. I don't know. But sometimes you might ask, well, what if they went to China and got $50 million and just built the poorest 10% people, a $3,000 house.
Mm-hmm.
In Ifakara, where I work, in the middle of Ifakara town for many years, this was one of the most malaria zones in the world. I think it was second only to northern Uganda in Apache. And entomological inclusion rates for malaria were very, very high, hundreds plus, 200s, 300s. Today, in the middle of Ifakara town, the malaria prevalence is nearly zero consistently. It's like, my colleague Lena was catching mosquitoes there for a year, and after 5,000 trap nights, she got a single infected mosquito. So even in very poor areas, you can find these small towns that have only very slight improvements in housing, just window screens, metal roofs, just slight improvements in the environment, and a health facility nearby, greater access to hospital care. Malaria rates just go down, significant, big time. And you see this across all urban areas in Africa. Yet only 20 kilometers away, you still have like 60% prevalence. So I am kind of convinced that you actually need very few resources, very little resources to make these improvements. But it depends on what the priorities of the country are. And this is why I started by saying it's mostly about in-country leadership. Where do you want to put your resources in the long term? If we treat these diseases, dengue, malaria, and so on, as a 5-year strategy thing, we're just not going anywhere. Because you see, in 5 years, then you have to start again. You have to look at these things as generational problems. What can we do now that will give us a permanent gain in 10 years' time? So resources can come, but that way, of course, people talk about many innovative approaches. You could go borrow money, you could, levy, put levies on tourism, for example, and so on and so forth. So all those things can happen. But at the moment, there's not enough to share. So I think it depends really on planning for the long term and prioritizing appropriately. Those really are the things that I would say. Even if we don't have enough money to do the job within the next 2 years, and you hear people, sorry, I'm going a little bit longer. You hear people say, we want to eliminate malaria by 2030. I mean, who is going to do that? I even hear people say, we want to eradicate malaria by 2050. I mean, this is unnecessary a distraction, because you're just not going to do it. You're going to put in $100 million in a country with 1% malaria and just take money away from nutrition and TB and everything else. I think countries have to prioritize appropriately, but really consider this a long game, so that we are taking this generationally, we are addressing multiple problems at the same time with the little resources that we have. Back to this.
Thank you. Thank you very much.
Frederick, can I add on to Frederick's comment? I agree, completely. But I'd also like to add that I think in the short term, we can try to work with the private sector a lot more in many countries. And by this, I don't mean sort of the suppliers of our interventions. I mean, the mining companies and the agricultural companies that are already doing vector control to, control malaria within their catchment populations. And I think they're also interested in, potentially helping out in the larger community. And I know there are conversations that are ongoing in countries that have been starting between national malaria programs and various private sectors that can help, in the short term, meet some of these coverage gaps that we have, in particular for countries that are interested in IRS, but down the line, maybe also for nets and, spatial emanators. And I think it's an area that we may not have been really focused on or tapping into that, at least in the short term, while we're waiting for these, longer term country investments that sort of this generational piece that Fredros was saying might be able to help us meet some of our near term goals.
Good. Yeah.
And maybe for me, add more to the funding discussion. Personally, I think that, I agree that there is funding gap, but I also think that there is a lot that we can do to really make use of the resources that we already have. First of all, identifying where the resources already exist. I do feel that sometimes there is a lot of wastage. I feel that you have a lot of programs or interventions that are implemented in a really wasteful manner. So if we can try to make
conferences, Corinne, and conferences.
Sorry? Yeah, I wouldn't agree to that very quickly.
And workshops.
So if we can really make efficient use of the resources that we already have, we will see that there is quite a lot already in the pot. But another thing that two other things I want to talk about, because I remember I was in Yaoundé for the minister's declaration about the high burden, high impact countries. And one of the ministers, I think the minister of Burkina Faso, said, they've called us here to ask us to increase our health budgets. But malaria is not just about health. Did you go to the agricultural minister to ask him to take on more of the malaria burden? Did you go maybe to the education system? Did you go? So it's much more about multi-sectoral approaches. And there is something that each sector can contribute. And if you make use of those, I believe you're going to see a greater impact. And then the third one is around localization. I know Fredros likes to talk about commodities and all that. But if some of these commodities are actually really kind of produced locally, because if I was developing a net as an African and I had maybe a manufacturing place where I'm leading and I'm doing it, I believe my people would want to use nets more efficiently. So that kind of country-led manufacturing, I think it's something that we should take a lot more seriously. It's going to have a greater impact overall, because now it will no longer be you coming to sell something to me, but I'm also selling something to my community that benefits my community as a whole. So just another approach to think of.
Yeah, thank you very much, Corinne. And I think this is absolutely a very important point. I think to engage the local communities, I mean, in the fight against those diseases, and the more engagement, I mean, the more commitment you have to those solutions, and pretty sure that you will have more efficiency on what you are developing. We have a second question, which is on understanding the best approaches to use in combination or not. That give the most cost-effective impact is an important area for obtaining more data to inform implementers. One question related to that, and I will probably ask Kristen to answer to this. For example, can spatial repellent work on their own?
Thanks, Frederick. This is a really important question, especially given what we were just discussing around budgets, because as I think Frederick mentioned even earlier on, this idea of layering everything on top of each other, that adds more costs when we are just trying to get one intervention out to everyone. And so this idea right now, that's when spatial emanators are being tested in the randomized control trials, is that they're put out there on top of universal coverage of bed nets. So is this realistic when we think about the budgets that our funders currently have? And I don't think it is, and I don't think that you necessarily need to have them on top of each other if they're sort of blocking the same part of the mosquito life cycle, which is inhibiting them from biting. So the challenge then becomes, how do we I guess test and get WHO recommendations that they could be used on their own when the trials are all currently done on top of bed nets. And a lot of the global procurers follow, especially Global Fund, follow WHO advice pretty exactingly. And so they won't do anything that really contradicts what WHO says. So if they say it needs to be on top of bed nets, that would be the only way, and we're not going to see them implemented in many places. I hope that we can do some trials then with spatial emanators on their own. I think there are ideas to do that as part of the new UNITAID project on spatial emanators. Maybe there are other ways of showing some kind of equivalence by with HUT trials, but I'm not sure. And I think it's a tricky question. So I'd like to turn it over to Frederick and Corinne about sort of trial design to show that they might work on their own, especially given that a lot of ethics boards might be hesitant about removing bed nets from an area when that's the standard of control. I think it's a very tricky area right now to generate that evidence. So I don't know if Corinne or Frederick have further ideas on that.
I can add a little point, if you don't mind. Yeah, so I agree. Yeah, we've had the trial that has shown a reduction in clinical malaria with spatial repellents, but on top of nets. And yeah, I wouldn't be in support of like taking away nets, and because we don't have the evidence yet. We could try to makeshift all these evidence. But another thing that we would consider is how it complements the items, because if you have areas like I said in Benin, even with a new net like interceptor G2, when we get to the third year, we don't even have them there anymore. We don't you don't have any more protection with these nets. So why can't we target, say, a special repellent at that point in time in the third year? So maybe we can use those kind of new tools to kind of complement and cover gaps instead of seeking to just only implement them on their own. I know there are funding issues around that, but if we are really serious about bringing down malaria or eliminating by 2030, like some of us would like to believe, I think that there is room to kind of really target all those gaps that we have when we already use the interventions that work, because we know that bed nets really work. So you can't take it away from a person because you don't know how the spatial repellent will work, but you can add it as an add-on tool in the third year when you have, when nets are no longer as effective. Yeah.
Thank you very much, Corinne. I mean, this is very interesting insight, and I think it brings up the topic of rotation, because we have been discussing a lot rotations, for instance, in iris products or bed nets, I mean, across years, across countries. I mean, here we're even talking about rotation of tool across a single lifespan of different tools. I think it's a very, very interesting concept. Another question from the audience, should we include environmental management, house modification, town planning, sanitation, mitigating the impact of agriculture, gardening in the list of intervention to be integrated? Who wants to go for that? Corinne, do you want to go for that? Because I think we're working on this topic as well.
Sorry, I'm trying to... Frederick, you wanted to go first. That's fine, please.
Yeah, I could. At some point, I hope we will come back to the question about integration, because there was a point that Corinne raised there that I wanted us to emphasize. Anyway, on the question of environmental management, house modifications, town planning, sanitation, whatever you call it, I call it social resilience, and I include education and household financing there. Should we include this in the interventions to be integrated? And these past few months I've been reviewing a lot of country-level national disease control strategies, and I'm very sad because in all of the ones that I have seen, the things that they call core interventions include nets, IRS, etc., etc. Commodities, as we say. And I understand that these are easy things to distribute. They give you some short-term gains that are moderate, like 40% reduction. And then after 2 years, it has become 10% reduction, and you have to do it again, and you think you're making progress. And a randomized control trial comes and says, we showed 40% prevalence, but then it's only lasts for 2 years, and then it's back. In my opinion, the things that are listed in these questions are actually the things that should be our core interventions. They do not necessarily have to be implemented by the Ministry of Health. A lot of them, the capacity is outside the Ministry of Health. Could be Ministry of Environment, Ministry of Agriculture, Finance, etc. One government approach with these things as the core. And then everything else that is commodities can come in for medium-term benefits while we are developing, while this household improvement, environmental sanitation, because this will take a lot of time. So I think the short answer is yes. And I'm personally very sad that ministries of health do not even talk about these things. You can read an entire malaria strategy that mentions that has the word housing is zero in there, environment zero in that entire strategy. And I think that's a very sad situation. And we have to change that, because everything else that is currently listed as a core intervention, yes, they're very good and they can give you significant gains for 1 or 2 years. And then after that, you're back to the drawing board, unless you solve these other things. So yes, let's do those short-term things for short and medium-term gains. But in the meantime, let's build structural resilience in the background. And I think that should be part of strategies. And let me stop there. This is a difficult topic to talk about because a lot of people are pro-ITNs and pro-IRS, and I am also pro those things. But I would like to hear what my colleagues have to say. Back to you guys.
Thank you, and thank you, Frederick. A quick comment, because we need to move to some other questions, because we have a...
Oh, okay. No, I don't really have any major comment, just saying that, yeah, these are really key interventions and they should be considered when we are talking about integrated vector management. And I do agree that they should also be centralized, even though, yeah, we also know that we want interventions that directly target the vector and the disease, but also every government should give attention to these types of interventions. Yeah.
Thank you very much, Corinne. I will move to another question that is maybe on the broader picture, where we have remarks saying that many of us have seen situations where, even armed with local data and clearly articulated subnational priorities, Ministry of Health and vector control stakeholders advocate for certain approaches that global financiers are hesitant to support. Any strategy or suggestion on how to address these challenges? That's a difficult one. No?
Kristen, you want to go first?
Yeah, I mean, I think this goes back to sort of that iterative dialogue we were discussing earlier, and really strong country ownership and leadership. I think that's where I've seen it work. That's what, Ghana obviously comes to mind first and foremost. Very strong advocates for themselves, have a lot of back and forth with the global funders, have pushed and been able to get, their IRS where they want it, while other countries have seen their IRS budgets and programs removed. So I think, a lot of it really comes down to that ownership and really, really strong leadership, and being able to have those back and forth conversations, and not just take sort of what they're told should be their programming based on the data that they have, and advocate for themselves.
Thank you, Kristen. Any more thought? Otherwise, we can move to another question. I see we have about 10 minutes left. There's a question about some specific technology, and especially SIT, and maybe in that bucket we can put SIT and GMO mosquitoes and all these related technology. Why is it not a bigger part of this discussion? how do you see those kind of technology? I mean, taking ground and developing in the current space.
I think there should be. Fredo speaking.
Yeah.
I think they should be in the conversation. SIT is a very powerful intervention and has been very successfully used against other arthropods and even against mosquitoes, actually. So I think that we should be speaking more about that, and especially now that we are starting to, think about climate change and how that might increase dengue fever in Africa. What are the transformational options that we have out there that can solve this problem? And I think we shouldn't close doors for SAT. In the beginning, I was saying that if we're going to go after innovation, after additional innovation, we have to very carefully select those innovations that will truly be transformational. And then those are worth investing in. Other than that, it's difficult to find something that will be better than IRS or ITNs or housing and environmental management. So if we're going to go for innovation, we better go for stuff that is likely to be transformational. And I think SIT, gene drives, Wolbachia, stuff like that fall in this category. And they deserve all the support that is necessary to get that done. I've seen some of my colleagues have done fantastic work with the ecological methods that involve communities. So, for example, basic trapping. If you involve the locals, you can achieve quite a lot in small countries or small communities. I think those should be tried as well. So I would expand the conversation to include that. I just want to say, to emphasize that in addition to that, of course, we have to do the things that can give us much more longer-term gains. So last point I want to make on this, which I would like to tie to the discussion about spatial repellents earlier, was I think at some point when Kristen was speaking, she mentioned ethics. And sometimes I wonder, if you're testing vaccines, let's say for Ebola vaccines, the moment the first vaccine proves to be effective, everyone else is not allowed to test a placebo. You must use the first vaccine, or you just can't test vaccines. And I'm wondering sometimes, because funders can actually give you $40 million or 50 to go and test a tool that they know will not be transformational, something that will probably be 20% prevalence. And then you go to this village, this district in some poor country, and you say, I've come with $60 million, I want to test this product for 5 years, and then I go away. I will probably show 20-30% prevalence. I will celebrate it in a Lancet paper. And sometimes if you think about what that $60 million would do in that district, you might realize it would probably build a lot of health facilities, hire a lot of nurses, do lots of real good stuff. And so I wonder where the ethics are in this. So, of course, this is a difficult question, but unless you're really sure this is likely to be transformational, we have to be careful as in terms of how much we are investing in these large-scale trials for this small intervention. This is nothing against the techniques that are being tried at the moment. It's really about us being considerate. Saying, okay, we use what we already have to make significant progress to solve this, address this challenge, vis-a-vis should we spend $100 million testing something that will return a 20% prevalence? Back to you guys.
Yeah, thank you very much, Fredos. And yes, indeed, the question on how we best make use of the money is also a difficult one. We have a very technical question here that I would may ask Corinne to answer there. It's is there any active ingredient that can be sprayed to prevent auto biting? We have been discussing about how to prevent the auto biting. Bed nets only protect when you're in the house under the net. So are we aware of any of those solutions that could be used and sprayed to prevent auto biting?
Yeah, I think when it comes to outdoor biting, we really do not have enough tools, and it's being recognized as a major problem in many countries as a problem, even though we still need to really review the data to understand how much of a problem it is and to see how we measure it. But right now, the tools that we have are not really that effective against outdoor biting. We could also try other methods. I think there are countries that have tried spraying outdoors, and I think also larviciding is a tool that can also be used for reducing mosquito populations outdoors, how they rest outdoors. So those are just some of the tools that can be used. But in my perspective, there is a lot of more research that needs to be done about, first of all, how important is outdoor biting, how much does it contribute to malaria, and also what are the effective tools that we can have out there. So it will be useful to continue that conversation here.
Thank you very much, Corinne. Any other thoughts, Kristen? Some thought around the outdoor biting problem and the solutions you are developing?
Yeah, I mean, I think I want to just loop both the outdoor biting problem also in with sort of this idea of residual or persistent transmission in general, because it's not just people being exposed outdoors. It's people being exposed indoors when they're not under the bed net, before they go to bed, when they get up in the morning, then outside when they're up in the morning doing their farming around or walking to school. But we've even seen during the day at schools in I think it's Kenya where the funestus are biting now. And so I think we have to think about it as this whole of why are we seeing persistent transmission in places like Zambia, where you've got PBO nets that have come in. They're doing IRS in places, and you still see 50% prevalence. I think, and Anopheles funestus in particular is a really challenging vector, and in some places you're just next to major swamp areas. And so back then, this ties back to some of that environmental management. Maybe it really is about finding where those breeding sites are and doing something about it. So I think, combining the environmental management as well as looking for new ways using spatial emanators outdoors. Are there other tools? We've been testing attractive targeted sugar baits to try to get mosquitoes at a different part of their life stage. And I think it's an area that we are needing innovation in.
Okay, thank you very much, Kristen. Good. I think we're reaching the end of our time slot, and there are still other questions in the chat, but we will not be able to answer them right now today. We'll try to get back with answer after the end of this session. I also would like to indicate that there will be a recording available of this session, so you can go and see it after for the people who were not able to join or want to see it again. I would like to thank very, very much our panelists, which have contributed to this very lively and passionate discussion. And we see also in the chat there's a lot of passion, a lot of emotions when we talk about vector-borne disease. I think all around this table we are motivated and animated by the same objective, is to make this much better and to try to get rid of those vector-borne diseases as much as possible. Again, thank you very much to our panelists for all these insights that you have shared with us and the time you spent with us. Thank you very much as well to the audience, who was very active in exchanging topics and questions and also discussions in the chat. With this, I would like to close the event here, and I wish you all a good rest of your day. Goodbye, and thank you.
Thank you.
Thanks, everyone.
Bye.
Thank you so